Hello, everyone. This is Mark Lynn. We've been getting a lot of questions about COVID vaccines, monoclonal antibodies, and possibility of doing those in non-RHC time. So we're going to put together a very quick webinar just on those issues, so we can discuss those with you and respond with the webinar instead of a long email. My name is Mark Lynn. I'm a CPA from Chattanooga, Tennessee. Here is my contact information if you do need to get a hold of me or you have more questions. Getting right into it, COVID vaccines and monoclonal injection shots, both are reported on the cost report, just like you would do for flu and pneumococcal. They're reimbursed at cost, and you will need to keep a log. That log should include the MBI number, or what we used to call the Medicare number, the date of the COVID injection or the monoclonal infusion as well, and so it's the date, the name of the person, and their MBI number. Those three things are all you need on there. So you want to keep up with those. You will also put your Medicare Advantage and replacement plans on this log as well, and that's the way you'll get paid for those. That is different than your normal flu and pneumococcal shots. You do not include the Medicare Advantage patients for flu and pneumococcal, but you do for monoclonal and for COVID vaccine. So keep up with that. Keep those on a separate log as well. They go on separate places on the cost report. So you'll want to definitely keep up with all of your supplies and direct expenses. Have a separate general ledger account set up into your accounting system for these types of supplies, so it'll be very easy for us to identify those, put those on the cost report. They do go on a separate line on the Medicare cost report as well. And then do time studies. Keep up with your times, because these monoclonal antibody injections, they will take anywhere between 75 minutes and maybe 2.5 hours to do that. By the time it takes about an hour to do the infusion, and then about 75 minutes or so to watch over that patient. So, I mean, at a minimum, you're talking about 2 hours and 15 minutes or so of time for one of those. So keep that in mind. I'm not sure if the simultaneous shots where they give you 4 of them in the stomach, I don't know how long they take to give, and how long. I know you have to watch people for an hour after that as well. So keep good time records so we can account for that time on the cost report, and you'll get fully paid for it. You will see that for fee for service, if you want a rural clinic and you build it fee for service, you would get about $40 for the administration of the shot, and for your antibody, for your monoclonal injections, you get paid about $450 for that. So there's a lot of money that you can get paid. I don't think you're going to get anywhere near $450 for this if you're an independent RHC. So that's one reason why we have a little section on non-rural health clinic hours. Some of our independent RHCs may want to do this outside of your normal RHC hours. Especially our rural health clinics really aren't designed to have a patient there 75 minutes and take up. We don't have enough exam rooms to really do that. So if you were setting up, maybe you are using one of the waivers and set up some space outside your rural health clinic, and you got 3 or 4 exam rooms set up just to do monoclonal infusions. You could do that, and you could put that on your cost report due to the waiver on location during this public health emergency. So we just wanted to give you some of the options related to this. If you're a provider-based rural health clinic and you're grandfathered in at cost-based reimbursement, you may want to make sure to do those in your rural health clinic, because your reimbursement will be better in that situation. This link down here are the rules on this, or the guidance that CMS has given us so far. Here's a work paper that I put together. That this is the same work paper we do for flu and pneumococcal. We're just coming up with the amount of time that we put on the cost report. We try to do a sample just to see how it would flow through on the cost report. In our example here, we gave 1,000 COVID vaccinations. Do remember that the actual cost of the vaccinations are free. You do not pay anything for that. So you're not going to be entering any cost for that. And I believe it's the same thing for the monoclonal antibodies as well. So there will be no direct cost, but it will be your administration of these two different products. So we figured up that it takes about what was it? 15 minutes to do the COVID vaccine, and I guessed 75 minutes. It's actually, based upon what I know now, it's probably going to be even longer than that. So it could be as much as like 2.5 hours, 2 hours and 15 minutes for this. So I may need to adjust that a little bit, but using these numbers, we come up with this very small percentage of time, 0.008013 for vaccines, and for monoclonal, it's a 0.02% of your time. So that's the percentages you'll get on the cost report. And the next thing we did was on worksheet A, we actually reclassified some expenses because we kept up with your expenses and we put those in the specific location here for COVID-19 vaccines and medical supplies. 31.1 is the cost center, and 31.11 is for monoclonal antibody products. So we put an estimate on some of the additional expenses besides the direct expense of the actual injections or the antibodies. These would be expenses on top of that you would put in this particular area. And then this calculation here will get us our percentage of payroll of your nurses that are actually doing these services here. That will be their percentage of time working there. And so this is how it's going to show up on worksheet A of your cost report. And this is worksheet A. This is just a reclass of expenses to the proper place on the cost report. And then this is how B-1 computes the reimbursement. You can see where pneumococcal is done, flu is done. This has been here forever, so it's always been this way. But now they've added this COVID-19 vaccines, and here's that 0.008 that I showed you earlier. Here's the 0.02 that we used here. This is your percentage of time that we talked about. Here's our direct expenses here, 10,000 for each one of these, and this basically picks up your payroll piece of it and your direct expense piece of it. And then we get a percentage, and then by the time you divide those expenses by the number of shots that you gave here, we got a $32.39 cost. Remember, if you'd have been doing this fee for service, you would have got 40 for the same thing. And same thing over here on our monoclonal antibody products. We did 500 of them. Our cost were 54,000. So our cost per injection or infusion was basically $110. So your number will probably be higher than that because your amount of time should be higher than that. Then you multiply that by the number of Medicare shots that you did. In this case here, we gave it to 200 Medicare patients. Over here, we gave it to 100. And this computes your reimbursement over here. You would basically get $25,000 for the services, $8,000 for your flu, $6,500 for your COVID-19 vaccines, and another $11,000 for your monoclonal antibody products. And do remember, here's where you'd put your MA injections as well for your Medicare Advantage patients. There's a place for them as well. Number of 1301 COVID injections to MA enrollees as well. So make sure that you put that information in there as well. Non-RHC hours. Here's a lot of people get real scared about this because I know a lot of consultants. I've heard it many times at the NARHC meetings. If you've not joined, please do so. There's an in-person meeting in October in Cincinnati, and it would be great to go back to that. I'm not going to go this year just because I'm old and have underlying health conditions, but you definitely should go. Non-RHC hours, what you'll hear is you're going to go to jail if you do this. I've been doing this 45 years. Nobody's gone to jail yet, as far as I know. It's complicated. It's different. It's some more steps you have to take, but it's not super complicated. It's a cost reporting nightmare. The actual cost report is set up to actually handle this. That's not a big deal. Your all-inclusive rate is going to go down. You hear that, and that's not necessarily true either. So let's look at let's look at the reality. No one's going to jail. It's not that hard. The cost report is designed for it. And if you do it correctly, your AR shouldn't go down. It may go down slightly, but it's not going to go down materially from that standpoint. And here's the cost report. Like I said, it's set up to handle non-RHC hours. So if you were going to jail, the government wouldn't say, well, here's what you need to do to do this. So the Medicare cost report is set up to where these are your RHC hours to and from, and here's your non-RHC. The days you operate as a non-RHC are located right here. So this particular clinic didn't have any non-RHC hours, but if you did, you would put this time here. Now you can't duplicate your times here. You can't be operating a rural health clinic as an RHC and as a non-RHC at exactly the same time. So these times can't be duplicated, but that would be called commingling, and that would be bad. So you don't want to do that. But the cost report is set up to handle it. So keys to making it work is treat all payers the same. And what that means is you don't just say, okay, you come in for a particular type of service and you say, oh, you're a Medicare patient. Oh, we only do that during non-RHC hours, so you have to come in during that particular time. That's sort of a financial triage on that patient. You can't do that, but you can set up a different location for monoclonal antibody infusions where you have a 4-unit pod and you tell them, yes, we do that at this particular location, and go over there, and that's going to be non-R, and you can build that out as non-RHC in that case. So you may want to look at that. So treat everybody the same. Keep up with the time that you're not a rural health clinic. Keep up with those visits so we don't count those visits on your cost report, because your cost per visit would go down if you were actually counting all of your visits during all of your time. You would lower your cost per visit, but the key to the cost report is to only count the RHC visits that occurred during the RHC time on that cost report. We would be reporting lower visits, which means our cost per visit would stay the same. And if you are doing this, Chapter 13 requires you to put your hours of operation on your door or very close to it. So put your hours of operation on there. If you're going to be operating as a non-RHC, you'll definitely want to do that. And then notify if we're doing your cost report or any of the other super well-qualified cost report preparers that are out there are doing it, let them know. Pick a date that makes it easy for us to keep up with, and we will exclude this cost from the cost report. It will go into the non-allowable section of the cost report that doesn't go into that computation of the all-inclusive rate. But it's not that hard. Some of the things that people do during non-rural health clinic time are long procedures, lab draws, annual wellness exams, IPPEs, trigger point injections, procedures, allergy shots, nurse-only visits, and transition care management. Those are type of things that people do. This will become less and less of a thing going forward as the independent RHC cap rate gets higher and higher. We're going to see less and less non-RHC hours. The reason why it was important now was mainly because it's monoclonal antibody infusions. That is something that this is the reason why we're having this very quick webinar, is just because a lot of people want to set this up separately and they don't have room for it in the rural health clinic itself. If they set it up separately, how would they keep up with that? So that's I think that's pretty much everything. If you want to know more, here's our website, ruralhealthclinic.com. We will be putting this information on that website under the COVID-19 resources section of this. And here is our Facebook group. If you haven't joined, it's not our Facebook group, it's your Facebook group. But we have almost 3,000 members now, and you're welcome to ask questions on there about this. I think it would be very, very helpful to you to join and to participate and ask all the great consultants that are on there that make this community super, and all the people that are out there working in rural health and treating these patients. Thank you for what you do. I know it's dangerous what you're doing. It's dangerous for you and your family's health, and we appreciate you guys very much. So thank you. for what you're doing. And that's all of the webinar today. Take care and stay safe.